All right, so for brain-body connection, one of the best things you can do is get the arm to feel something so the brain remembers how to do something. So sensation in, movement out. An easy way to do this is massage, and you cannot do it wrong. Massage the arm, the fingers, the shoulder, everything you can. Every day, you can do it twice a day. You can't do it too much. Use any kind of lotion that you have around the house. I like to start with the shoulder and move my way down. So typically, like you want to start here. You want to really get your hands around the shoulder, especially focusing on the front, because this is the muscle that tends to get short. And on the back, you want to give as much input. Also feels really good for the person who's had a stroke just to have somebody touching their arm. So, massage all the way down. You want to make sure you're taking and massaging the front of the elbow, the back of the elbow, and super important is the wrist and the hand, because that tends to get really tight. So with the wrist, you can massage the top of the wrist, massage the back of the wrist. Another thing is if you actually kind of get a little bit low, you can come to the front and you can massage the hand. One thing that people tend to forget is that although our hand feels like one thing, right? We grab something with our hand. It's actually comprised of all these tiny little muscles and joints and tendons that need massaged. So you want to take your hand and you want to take each finger. You want to massage each finger. You want to go inside of the fingers. Get it to feel. You want to massage the palm, the wrist. You don't want the wrist to get tight, so you really want to give input to the wrist. And the back of the hand. Do that for about 10 minutes. Just massage, massage, massage. Another cool trick that I like to use is BioFreeze or arthritic cream, or any kind of arthritic cream you can get at like any Walgreens, CVS, any over-the-counter piece. So like this is a great sensation therapy because it makes you feel. It's tingly, it's cold. It reminds the brain, oh my gosh, yes, my arm feels something. So the whole point of sensation therapy is to get that arm to feel anything. Again, BioFreeze has a smell to it, but you have kinds that don't have smells, and you're just going to massage the same way. You can't do this too much. I do this a couple times a day. Just get it to feel something. I'm sure that feels really cold and good. Yeah, and it's getting the hand to just feel something again. Now let's go through the different areas to massage that would help with sensation therapy to wake that brain-body connection. I like to do this in a laying down position. I think it's incredibly easy for the caregiver to get to the person and very comfortable for the patient. So let's get started. Massage number 1 for the shoulder. So I like to have the person in a laying down position for easy access to the shoulder. I like to make sure there's BioFreeze and massage. You can do BioFreeze and lotion, any kind you'd like, or just lotion. So for the back of the shoulder specifically, I like to make sure you're going with all areas of the fibers when you massage. So you can go away like this. You can go towards the spine, away from the spine, always keeping an open palm. You can also go down and you can pull up. Massage 2 for the shoulder. So for this, I like to have the person laying down whenever I'm trying to do anything for the front. Again, I put some lotion on my hand. You can use any lotion, and I like to use arthritic cream. Sometimes it helps to stimulate even more the skin if that person can tolerate it. But again, benefits of massage are going to be improving circulation. It's going to decrease pain. It's going to help with that tactile input. So I'm touching that touching input with the skin. That's all that we're trying to do, is excite the brain, body connection, and remind it that this is what my arm is supposed to be doing. It's supposed to be feeling something. So the whole feel, do, feel. But specifically for the front of the shoulder, while they're on their back, I like to pay attention to just this area above the pectoralis muscle, which is just right up here, this area here in the front of the shoulder. So this area tends to get super tight. So this is where massage is going to be incredibly beneficial. So if you have them turn their neck, you can take your hand and do a sweeping motion, and you can massage down and you can massage up. Remember, when you're massaging, you kind of want to hit all different areas. So you can always go one direction with the muscle and then the opposite direction, and then you can go in and then you can go out. Sweeping motions, you can hit the shoulder You can come to the front of the shoulder. That's an area that tends to get super tight that you do not want to get tight. And then again, just to make a nice sweeping motion with my hand back, forth, all directions at the very front of the shoulder. For upper arm number 1 for massage, I like to have the person on their side. I like to make sure that when you're massaging the back of the arm, the tricep, so you want to really make sure you're focusing in on big, broad movements. You can do circles. Really an area you want to hit is that upper elbow. So again, you can always go with the muscle fibers. You can go the opposite direction. You can go in, you can go out, just anything to wake up that back area of the upper arm. And there you go. Massage number 2 for the arm, something you can do when you're laying on the side. You don't have to, but you can place the person's arm on a pillow for ease of access and for extra support. But for the upper arm number 2, you want palm up. And again, I have lotion on my hands, and you're going to massage the bicep. So when you're massaging the bicep, you really want to focus at the top of the bicep and then by the elbow, because this is where the bicep inserts. Like it starts and it finishes. So if you want to excite and wake the bicep up, you want to make sure that you're hitting all areas. So for this, again, big sweeping movements. I can go up, I can go down, I can go across, I can go in, focus more towards that area. You can get a finger and do circular motions. Again, anything to get that bicep to remember what it's like to feel something, so then it wants to start to do something. For forearm number 1 for massage, I like to have the person laying on their side, but you certainly could do this sitting up if you'd like. For this, again, use lotion or BioFreeze. For the back of the forearm, I like to focus on right below the elbow. There's this area right here that helps to actually open and close the hand. So when massaging, I like to make sure I'm hitting this area. Again, you always want to do broad sweeping movements. You can go in any direction. You can go towards the wrist. You can go away from it. You can go in. You can go out. It's a way to excite that brain-body connection and really wake that up and remind that forearm, the back of that forearm, this is what you're supposed to be doing. This is how you're supposed to be moving to get that hand working again. Moving on to forearm number 2. So for massage, for the second part of the forearm, I like to hit the inside of the forearm or where the palm is up. So for this area, this is going to be the area where if you're working on wanting to close the hand, you need to excite this area. So for this, I like to take my hand again in a sweeping motion. You can use even your palm. You can go down and you can go back and you can go in, you can go out, you can do circles. A nice area here is to take your thumbs and to massage into the wrist. That's an area that oftentimes gets neglected and gets super tight. And this often feels absolutely incredible for the person who's having the massage. So remember, the main principle with sensation therapy is getting that arm to feel something so that it reminds the brain what it's supposed to be doing. So hand number 1 for massage. I like to have the person on their side, but you could definitely have them sitting. I like to make sure when I'm doing the back of the hand that I'm taking my fingers and I'm almost just gently following the grooves of the knuckles. I also then like to take my thumb and I like to move my way up the finger to the nail. Don't forget you have nerves and muscles and tendons all through these fingers. So you want to make sure you're hitting each area. You can also take your hand and go through and to the sides of those fingers just to help stimulate the hand and remind it that this is what it's supposed to be doing. It's supposed to be moving. So you want to excite the brain and remind it, hey hand, wake up. So for hand massage number 2, I like to do the palm of the hand. It's so important that you do this. So for the hand, you want to make sure you're constantly stimulating it. One way to do that is massage. I have lotion on my hand, and what I want to do is pay attention to each area of the hand. So I like to do a little bit right above the wrist. You want to hit this area right by the thumb and right over by the pinky side. You want to, this has a lot of tendons and muscles coming through here, so you can start by waking this area up, and then you're just going to take your hand and you're going to move through each finger. Pay attention to each finger. kind of do something like that. Again, you can use your palm and you can go in any kind of direction. Just massage, help it to feel something again, help remind that brain-body connection how it's supposed to be moving.